Now, it's reckoned that around 70% of people with no vision at all, that is, not even light perception, suffer from a particular form of disturbed sleep. It's known as non-24-hour sleep-wake disorder. It happens because your 24-hour sleep clock, which is regulated by the incidence of natural light, gets out of kilter, and that causes sleeplessness during the night and drowsiness during the day. Well, this can obviously have a very disruptive effect on many aspects of your life. Most people have this balance maintained by melatonin, which is a hormone generated by natural light. So what some people suffering from the condition have had to do is take melatonin artificially as a drug. As we've reported before on this programme, melatonin isn't licensed in the UK, so some GPs won't prescribe it. That leads to people facing the uncertainty of buying it online. Now, though, we're hearing about a new drug, Hetlioz, which has been made specifically to treat this problem and has been approved in the States by the FDA, that's the Food and Drugs Administration. I've been talking to the chief executive of the company, which is producing it, but we also brought him together with Lucia Bellini, who's been dealing with this condition since childhood.
My body clock shifts forward roughly about an hour and a half every 3 days. I may go to bed at, say, 10 o'clock and sleep and wake up at 6:30, and that will last for about 3 days, and then it will just get later and later and later, and it takes me about 4 weeks to complete the entire 24-hour cycle. And there is nothing that I can do about it. So I've tried, because I've had this problem for at least the last 15 years or so, and I've tried to force myself to stay awake during the day, and I still won't sleep at night, so I could last for about 4 days without having any sleep, or maybe 2 hours sleep in 4 days.
So what effect does that have on you and your life? I mean, clearly it's disruptive, but can you explain what that does and how you feel?
Yeah, I mean, it's ruined some very sort of significant times of my life, definitely. I mean, I definitely struggled through school and university. I thought it was my fault for years. I didn't know until I was about 21, so about 8-9 years ago, that it was linked with having a visual impairment.
And presumably there's a build-up of this when you're going through the cycle that you described.
And I think it's really difficult because I know they're going to build up, and I know it's going to get worse and worse for me. I know in a few days' time I might really struggle to stay awake, and I spend nights kind of lying in bed trying to sleep, and then I know that in a few hours' time, when it's time to get up, that I'll be falling asleep during the day or really struggling to stay awake.
So what treatment do you have?
I have melatonin. And I think it's really important to sort of emphasise that I get my own melatonin online, which is absolutely not recommendable at all. I started off talking to my GP. He was really understanding. 1 week he was on holiday. I went to get the repeat prescription, and his son-in-law, who's another GP in the same practice, refused to prescribe it to me, and he said that we can no longer prescribe it because we don't know enough about it. You should work out other ways of dealing with this problem. And I thought, well, it's either that or I'm going to end up I'm not going to be able to work. I'm going to really struggle. So I got recommendations for a website. I spoke to a friend of mine. I also looked on the Circadian Sleep Disorders webpage. I did a lot of research, and I get my melatonin online, and that helps.
Well, how much does it help, and how effective is it, would you say?
It helps a bit. So if I haven't slept at all during the day, it will help me to sleep at night. I do have quite a lot of bad nights where I still don't sleep, but it definitely makes a difference. So if I manage to stay awake all day, it's very possible that I will then get a good night's sleep.
And what you said, it's not recommended to get it online. Why not?
Well, because nobody knows what they're getting.
Let me bring in Dr. Mihail Polymeropoulos, who is Chief Executive of Vanda Pharmaceuticals. Now, your company has developed a drug which you think will help with Lucia's problem. What does your drug offer, for example, which is different from melatonin?
It is actually stories like Lucia's that inspired us over the years to attempt to develop a therapeutic with a consistent efficacy and understood safety profile so that patients with non-24-hour sleep-wake disorder can take on a continuous basis.
So does it do something different from melatonin?
Melatonin, the actual molecule that endogenously circulates in our body, has been perfected through evolution to circulate in the blood as a hormone. It is not a molecule that you can eat as a pill and be predictably absorbed and have the kinetics in the bloodstream eventually result in the efficacy and safety profile.
So would you say that this is going to offer a kind of stable solution for people like Lucia?
We conducted 2 control clinical studies. One of them lasted for over 6 months and compared Hetlios taken once every night at the same time versus placebo. Those patients that received Hetlios showed significant and clinically meaningful improvements on their sleep-wake cycle. It is important to emphasize that non-24-hour disorder is not just another sleep disorder of amount. It is actually about timing. As Lucia very eloquently described, the advancing timing of sleep propensity by half an hour every day, resulting in something that us, rest of the people that don't have non-24, should actually try to understand as if we are traveling one time zone every 2 days eternally.
Now, we understand this is likely to be more expensive than, say, melatonin, which could have implications clearly if it's going to be bought by the NHS. Would you expect that to be the case?
I cannot make a comment on pricing, but the direction is that it will be priced like other orphan disorder rare drugs. There are drugs for multiple sclerosis, narcolepsy, and other disorders that affect a smaller number of individuals.
So how long do you think it might be before this is available in the UK?
It is a very complex process applying. So hopefully as soon as possible. We do have patients elsewhere in the continent, in France and Germany. Some of them have taken the drug in a clinical trial setting for over 3 years, and we want to make sure that we have a European approval.
Were there any side effects with the drugs in the trials that you did?
We studied the safety in over 1,300 patients, some of them for over 1 or 2 years. The side effect profile was primarily mild in nature, with some headaches that eventually went away. The other was a incidence of vivid dreams. Most of the patients continued nonetheless. OK. Lucia
Bellini, you're here listening to this. It's your problem, and you've got the chief executive of the company in front of you. Any points you'd like to put to it?
I think even without knowing if the drug is going to be successful to many people or not, the fact that somebody has actually wanted to research and try to make a difference, because I just feel that because not many people know about this issue, that it's been kind of left behind.
Personally, I'm a scientist, a physician that worked on the Human Genome Project for many years, and therefore I'm keenly interested in understanding the molecular mechanism of disorders and developing therapeutics to precisely address the disorder and not just the underlying symptoms. So we are committed not only to spread the news about non-24 and what our drug may do, but also begin to forge a public relationship of the blind community with the sighted people. And we have a responsibility, if we can remove some of the hurdles, to do so.
That's Professor Mihail Polymeropoulos, and you heard Lucia Bellini as well. We'd like to hear about your experiences of this condition and how you've dealt with it. Details about how to get in touch with us at the end of the programme.